So for everyone that might listen later, Karin Ashley is joining us today. I'm really excited to introduce her. She is a board-certified integrative women's health nurse practitioner who helps couples optimize their hormones, health, and fertility using integrative medicine principles like nutrition, therapy, detox support, cycle awareness, and functional medicine testing. She believes that men and women are whole people, mind, body, and spirit, and that a comprehensive fertility care should aim to improve every aspect of their health. And when she's not helping people make babies, she's chasing after her own, including all 6 of them. They are so cute. Cooking meals for her family and trying to keep her plants alive, which I see your plant there in the background.
Doing a good job. It's dying though. That one of the branches fell off. The children are okay though.
Excellent. They look happy and healthy whenever I see pictures of them.
Yeah, yep. And one of them actually here on the floor. So I hope he behaves for us.
Okay, is that the newest one?
Yep.
Awesome.
He's still exclusively breastfed, and so he kind of stays with me all the time. And then if he gets unruly, I pass him off.
Yeah, that makes sense. Well, we have a few questions to kind of start. And Mom, this is my mom, Marilyn, for anybody.
Hi, nice to meet you.
She has, if she has any live, then you're more than welcome to ask as well. I'm trying to pull up. Here we go. We have like a few kind of general maybe topics, and where I thought maybe we could start, Karin, is to just talk maybe a little bit about Hormone 101 and why people should pay attention to their hormones, men and women.
Yeah, absolutely. So hormone health is not something that we are really educated well on. It's not something that was really well covered in that 4th grade sex ed class, or even the high school sex ed class that was basically just to scare you into never getting an STD, so our education is really lacking in body literacy, which means the information that we know about our bodies, and then the ability to read our symptoms and to know, what is that I am in an imbalance, and then, what can I do about it? So that I feel like sex education has really failed in that way. Not saying that it has to come from the school system, even, mothers aren't aware of this information themselves, and so they can't teach it to their children. And then there's some taboos around talking about things like this. And so one of my big points of emphasis is to help women learn how to pay attention to their body and the signals that it's giving them. And then the symptoms surrounding hormonal imbalances. And so body literacy is a big thing. And then empowerment, once you have that information about your body, how can I advocate for myself in going to the doctor, and then in getting the care that I need, knowing, that I need to improve upon certain areas, and being able to get that support for yourself. And so body literacy and empowerment are my biggest things in, ensuring hormone health long term. So it doesn't just apply for when you're just learning about it, when you just start getting your period, and then for men, like when they go through puberty, having information about what affects my hormones, and when I get into an imbalance, what can I look for, as a potential cause, and then treat that instead of going through the traditional or the more conventional route of, you have an imbalance, now you have a diagnosis, and here's the medication for that. You're able to look back and see what might have caused this. I went through a really hard week at school, like a medical school or any kind of intensive thing, or, a rough week at work, and you weren't sleeping well and weren't resting well and had high stress. And now all of a sudden you're sick. You can kind of connect those dots for yourself and say, oh, you know what? Maybe I need to rest more, and, kind of solve some of those problems on your own. So hormones we think of as being, estrogen, progesterone, testosterone, and that it's so much more than that. There are metabolic hormones that regulate your blood sugars and your energy and the way you store and use fat and things. So there's those, and then there are stress hormones that are released in times of even just waking up in the morning. You have stress hormones released, and then in times of higher stress or chronic stress, you have a totally different hormonal situation with those. And so these are not all individual. And then thyroid too. So these don't live in little silos. You see the thyroid doctor for the thyroids, you see the adrenal stuff goes to a different doctor, the sex hormones go to the OBGYN. They're all related to each other. And I think that's something that our conventional medical system gets a little mixed up, is that these are all related, that your thyroid's not acting, in its own little world, that they're all affected by the different systems. And so hormone balance across the board, there's a lot of things that you can do with your lifestyle and with your diet to keep those in harmony with each other and in their own systems as well, through lifestyle, nutrition, and then sometimes supplementation if you get into an imbalance. So
yeah, I think that's really well said. I was just thinking about what would our world and our society look like if we just taught people about their bodies.
Right.
In like elementary and like public education included that versus just like STD, and
fear tactics. Yeah.
Yeah. How different would we be? And I think I love that you mentioned too, just how conventional medicine, traditional medicine really sends each of these hormonal imbalances to a different specialist, like an endocrinologist, a PCP, a thyroid specialist, and maybe an autoimmune sometimes if you have other certain hormones. And then, OBGYN, it all goes to these different places. Nobody really addresses cortisol, maybe a psychiatrist if they think about it, but they don't check that. And if the only time you ever really check female hormones or testosterone is when testosterone males, they don't often get it checked, even when they're really fatigued and having issues. And women often don't get their hormones checked unless they're having infertility.
Right.
And it's just really sad.
Because a lot of these conditions start really early on in life. So PCOS, one condition, it's kind of marked as a gynecological condition. It's really a metabolic condition, but that starts in adolescence at onset of puberty. And then endometriosis can do that as well. If you have a really, imbalance in your estrogen and progesterone relationship, those start right away. But the average time to diagnosis for both of those conditions is over 10 years. Wow. And so you have 10 years of suffering through this, and the compounded effect of those systems being imbalanced having a ripple effect throughout the rest of your body. If you knew at age 13 that it wasn't normal to be in severe pelvic pain with every period, and people went looking for a root cause, you would have saved 10 years of misery, and then being on hormones that you didn't really want to be on in the first place. Some people are fine with being on hormones. That's what they want to do, and they feel great on that. That's fine. I'm not anti hormone replacement, but in terms of contraception or through menopause. But some people that's not what they're aligned with. They just didn't want to be on a medication, but think that's the only way to deal with what they have. And they kind of get the message that you have this, you're broken, and here's the fix for it. Not there was a cause to this and we can address it, and then you won't have to be on the medication, or you can be on less, and you can sort of mitigate all of your risks on your own.
Yeah.